We are back with Dr. Deborah Grant, a Chief Nursing Officer for Cone Health. She is answering all of your COVID questions, and we have quite a few of them. So let's get started here. Someone's wondering, I've heard you are immune from COVID-19 for 90 days once you've had it. Is this true?
That's what most of the studies have found, is you have enough antibody built up for 90 days, but everybody's individualistic, because what your body does may be different from somebody else's, but that is the average, is like 90 days that once you've had COVID, you actively have the disease, that you may not be able to catch the disease again, catch this virus again.
Someone's wondering, how long after you test positive for COVID do you have to wait to get tested again?
There's really no need to get tested again, so I'm not sure if they're just needing that for work or something, but we'd say at least 2 weeks if you're going to get tested again, because as long as you have that virus load within your system, you're going to be positive.
Someone texted us wondering how the J&J vaccine is holding up with the new variants. They said that they're double vaccinated for Johnson & Johnson, but they've really been struggling to get information about Johnson & Johnson. Honestly, it's kind of the same. I agree. I haven't heard anything about J&J for a while.
No, we actually are giving for the boosters, the people that had J&J, now many of them are getting the Pfizer and the Moderna just because it was not holding up as well. So I would say most of them today aren't getting a second J&J. They've been getting Pfizer and Moderna.
So would you suggest, if there is a time in the near future when when you're asked to get another booster, would you suggest getting a different one then?
If they had the J&J, they want that again, it can be available, but I would say most everyone is doing the Pfizer and the Moderna now.
Got it. We have about a minute left. Someone's wondering, is the original COVID-19 strain still circulating, or has it died out because of the variants?
So, it's interesting. We were on a call maybe the last week, and we said there's still Delta around because Delta is still here, and we've got Omicron. But the original COVID, virus, we haven't seen that. But again, we're probably not testing for it. It could be around. But the predominant number in our country right now is still the Delta and the Omicron.
We have about 15 seconds, so if you could answer this quickly. Someone's wondering when we could get our 4th vaccine dose.
We don't know that yet because testing will continue with all the studies to see when do you need it again. So right now we know people are fully vaccinated and covered for 6 months.
So stay tuned. Doctor, thank you so much for your time today. We do appreciate it. If you've missed any of this information or you'd like to watch all of our segments again, just check our website in the To Your Wellbeing section. We'll be right back.